Good day everyone, welcome to our subject, Building and Enhancing Literacies Across Curriculum. This is the continuation to the report of my group mates, which is about art and creativity literacy. Our topic is about problems and disorders related to poor eye-hand coordination. Course learning outcomes. In this lesson, we are able to understand the problems and disorders related to poor eye-hand coordination. We can identify the conditions and factors of eye-hand coordination. We can apply knowledge of disorders problems of eye-hand coordination according in different stages. We can give value the art and verbal creativity literacy and evaluate aesthetics in real-world situations. So stay tuned, guys.
Good morning, everyone, and this is Art and Creativity Literacy. And this is the continuation to the report of my group mates. And today we are talking about problems and disorders related to poor eye-hand coordination. So we have here two main conditions for inadequate eye-hand coordination. The first is vision impairment and the second is movement disorders. Vision impairment, it means that person's eyesight cannot be corrected to a normal level. This is according to Department of Ophthalmology, University of Pittsburgh. And it may be caused by a loss of visual acuity, where the eye does not see objects as clearly as usual. It may also be caused by a loss of visual field, where the eye cannot see as wide an area as usual without moving eyes or turning the head. Vision impairment means it is the problem of our eye sightedness. Our sight, it means is like the problems of our seeing, and which we cannot see thoroughly the objects. And we have here two types of vision problems. This is the most common adult vision problems and the most common childhood vision problems. And for adult vision problems, they experience blurred visions called refractive errors and related macular degeneration, glaucoma, cataract, diabetic, and retinopathy. And for childhood vision problems, they experience also blurred vision called refractive errors, the same for the common adult vision problems. Second, for childhood vision problems is child crow's eyes called strabismus, and the last lazy eye called amblyopia. And blurred vision or refractive errors, there are three common types. First is nearsightedness, which is mean we can see clearly up close but blurry in distance, meaning we can see the things in close but blurred in distance. And the second is the common types of blurred vision is the farsightedness. It's called hyperopia. It's when you can see clearly in the distance but blurry up close. This is usually due to a condition called presbyopia. Once every three people 40 years or older in the US will need glasses to read the smaller print. And astigmatism is another condition that causes blurred vision, but it is because of the shape of the cornea. So what are the risk factors for developing refractive errors? First, factors or reasons, this is the reasons for family history, and the second is advancing age. Yes, of course, the family history is one of the factors which we can experience refractive errors, and the second reasons or factors is the advancing age. Knowingly, when we become older, our seeing is to change because of it depends on our age. And second is crossed eyes or strabismus. Strabismus occurs when the eyes do not line up or they are crossed. One eye, however, usually remains straight at any given time. Common forms of strabismus include esotropia, or one or both eyes turn inward toward the nose; exotropia, one or both eyes turn out, also called wall-eyed; and hypertropia, or one or both eyes turn up; and the last is hypotropia, one or both eyes turn down. So what are the risk factors of strabismus? First factors also is family history. Second is having significant amount of uncorrected farsightedness. Third is disabilities such as Down syndrome and cerebral palsy. And the last is stroke or head injury. The last is lazy eye, amblyopia. Amblyopia, often called lazy eye, is called problem that is common in children. So it is a result of the brain and the eyes not working together. So the brain ignores visual information from one eye, which causes problems with vision development. So what are the risk factors of amblyopia? First factors is premature birth. Second, low birth weight. Third, retinopathy or prematurity diagnosis. Fourth, cerebral palsy diagnosis. Fifth, intellectual disability diagnosis. Sixth, family history or certain eye conditions. Seventh, material smoking, drug or alcohol use. And lastly, surgery on eye muscles for esotropia or eyes turns in toward nose. And we proceed to the second vision impairment, which is movement disorders. It refers to a group of nervous system or neurological conditions that cause either increased movements or reduce or slow movements. These movements may be voluntarily or involuntarily. So meaning this kind of vision impairments, or we can control it or not, and mostly it is knowably happen to us. And these are the common types of movement disorders include Parkinson's disease. A second is atypical Parkinsonian disorders. Third, ataxia. Fourth, tic disorders, functional movement disorders, Huntington's disease, essential tremor or dystonia. And these are the signs movements of disorders are follows. Signs and symptoms of movement disorders vary depending on the underlying cause. In general, signs and symptoms of movement disorders include problem with physical coordination, trouble walking, episodes of uncontrolled movements such as during a seizure, muscle weaknesses, twitching or muscle spasms, hand-eye coordination development and stages. It is the coordinated control of movement of the eye and hands that guide our reaching, grasping, etc. It uses the proprioception systems in the hand and or legs and visual system or coordinates this movement. These stages, the hand and eye coordination is being used. It helps us on how we develop our eyes and working together. So these are the age of children where they develop in between birth and 3 years old. They develop the vision needed in order to start following objects with their eyes. They also begin basic eye-hand activities such as grasping, reaching, feeding, and dressing. They also start to recognize directions such as up, down, in, and out. And last, they begin to manipulate smaller objects using fine motor skills. And between 3 and 5 years, they start to develop a preference of right or left-handedness. They continue to understand concepts such as direction and place such as up, down, under, beside. Climbing, jumping, running, galloping, pushing, pulling, and climbing stairs one stairs at a time. They also learn fine-tune eye, hand-body coordination, and eye teaming as well as depth perception. The child between 5 and 7 years, children above the age of 5, they continue to fine-tune all the skills as well as learn to visually attend to and focus during schoolwork activities in the classroom or at home. They also tend to decide whether to be right or left-handed. So let's proceed to understand what is visual literacy. It is the ability to interpret, negotiate, and make meaning from information presented and meaning in a form of an image, extending the meaning of literacy, which commonly signifies interpretation of a written or printed text. It is based on the idea that pictures can be read and that meaning can be through a process of reading. So meaning, visual literacy. This is our ability or skills to interpret what we have seen or what we have learned and using materials or the printed text or image. It is basically on how we describe and how we use learns and skills we have gained in understanding the visual forms. So it is also involves closely examining diverse visual text across a range of text types. These text types includes non-fictions like textbooks, picture books, art, advertisement, posters, graphic novels, comic strips, animations, film clips, web pages, and more. So let's go beyond the next verbal creativity. Knowingly, it is an ability to think creatively and to measure one's fluency, flexibility, and originality of a verbal form, which deals with the words and sentences, according to Guilford 1967. It involves multiple cognitive processes such as memory retrieval, imaginative process, cognitive control. So it means verbal creativity. It is a being creative of communicate, of using our verbal skills like communicating others, of being flexible of what we decide or to do, or to being original person of dealing others. It is being using our skills through the process of verbal forms. So next is aesthetics. It is a branch of philosophy that deals with the nature of beauty and taste, as well as the philosophy of art. It examines aesthetic values often expressed through judgment of taste. So, meaning aesthetics is the way how we judge and other artworks or other things based on our experience, on how we give values, on the way we express our insights and expressions of being the one of the examples of others artwork or things. It helps us on how we interpret their being philosophically of being artistic. So it also covers both natural and artificial sources of experiences and how we form a judgment about those sources. So it also considers what happens in our minds and we engage with objects or environments such as viewing visual art, listening music and reading poetry, experiencing a play, watching a fashion show, movie, sports, or even exploring various aspects of nature. So aesthetics, as we mentioned earlier, this is how we we give importance or how we adapt the others with others objects or happening around us or based on of their experiences. So we can learn those some of my discussions in the reference in what we have seen in screen. For more information, we can click this link for more learnings outcomes that we need to have. And that's all my report. Good day, everyone. Thank you.